hyperventilation syndrome. So what's going on? You hyperventilate. Why? Because of some stressors or maybe a spontaneous hyperventilation. What happens after hyperventilation? You lose a lot of carbon dioxide through your lungs, and that leads to a low carbon dioxide level and a low level of acids, because carbon dioxide is equivalent to acid. So your blood becomes alkaline, meaning your pH becomes high. And whenever the pH becomes high, the hydrogens that are bound to albumin leaves. Now, this albumin binds to calcium. It binds to calcium, which was present in the serum. So increase calcium binding to the albumin, and that leads to a fall in the free calcium level. And whenever there is a fall in the free calcium level, that causes tetany, carpopedal spasms. The initial manifestations of hypocalcemia may be a paresthesia, maybe perioral numbness. You have some numbness around your mouth. So paresthesia, numbness, etc. What are the other features that the patient can have? The patient can have palpitation, chest pain, dizziness. So those are the features of a hyperventilation syndrome. And how you can confidently diagnose this condition? For diagnosis, we can ask the patient to voluntarily overbreathe for a minute or so. So this voluntary hyperventilation, the voluntary hyperventilation will provoke to this attack of hypocalcemia leading to numbness, paresthesia, and carpopedal spasm. And after these syndromes are elicited, we ask the patient to breathe into a paper bag, and that relieves the symptoms. So how do you treat hyperventilation syndrome? The treatment is usually very simple. First of all, we have to reassure the patient that nothing's serious. And then we teach the patient how to relax. We teach him the relaxation techniques. And if the patient has an attack, we teach them to breathe into a paper bag. So reassure, relax, and whenever you have an attack, you breathe into a paper bag. That's all about hyperventilation syndrome.